All right, we're gonna move on to the kind of a policy portion of our event tonight. We're gonna hear from a few deputy secretaries at some of the agencies around the state that are doing a lot of the work to implement a lot of the positive things that we've been talking about. And so, is Deputy Secretary Crawley here? Oh, there she is in the back. So we're going to start with Deputy Secretary Crawley. We are really excited for a new initiative being led by the Maryland Department of Aging. Governor Moore signed an executive order in early January establishing the Longevity Ready Maryland Initiative, directing the department to develop a plan to coordinate and build upon efforts across state agencies to proactively address the needs arising from a growing older adult population in the state. And so here to speak about that for a few minutes is Deputy Secretary Jennifer Crawley.
Hi, good evening. It is such a distinct pleasure to be here with the Maryland Mental Health Association and all of you here today, and to reintroduce the Maryland Department of Aging to each of you. So we are the State Unit on Aging. In each of your jurisdictions, we have what are called AAAs, Area Agencies on Aging, and they are really your resource for all things older adults. And I see one of my colleagues over here with Carroll County, and I see many around here. So I just wanted to give you a brief overview of what we are doing as the Department of Aging during this legislative session, and also to invite you to be our partners. We are very much interested in building capacity and increasing capacity across our AAA network. We are also very interested in hearing about what matters to you as it relates to mental and behavioral health. If nothing else, take this away. We want to partner, okay? And the other thing that I want just to note is that, and you all know this best, when we're talking about behavioral health, you don't age out of it. So we need to ensure that we utilize a longevity lens when we're talking about behavioral health and cognitive health. We have one brain. We don't separate the two between cognitive and behavioral health. We are here to support the well-being of older people, and that is their health, their spiritual health, and their physical health. And that includes mental health. And so I just want you to know that that's where we are coming from as the Department of Aging. And again, we want to partner. We want to help train. You know, the crisis intervention teams were called out. Really critical community resource for caregivers and for older people. So we want to make sure that we are here to help train and to provide advocacy and to work together to really ensure that we are meeting the behavioral and cognitive health needs of older people across our state. So with that being said, Dan mentioned that we just recently had an executive order passed. If you have not read it, it is pretty darn exciting. It is the Executive Order on Longevity Readiness. So Longevity Ready Maryland. Anybody have any ideas what we're trying to tackle with that? Just shout it. Long-term care? Okay. Well, if you're not aware of it, Maryland is growing older, right? Just look around. Look at all of us, right? And that's what we want to be doing. You know, people will talk about, not wanting to have another birthday, but honestly, you want to be having other birthdays, right? We are all aging from day one, and people are living longer, and as we are living longer, we want to be matching those longer lifespans. We want to be matching our health spans to those longer lifespans. And so what we need to do as a state and as a nation is really think about, what does it mean to be longevity ready? What does it mean to have a population of older people? By 2035, we're going to have more people over the age of 65 than we do under the age of 18. Yeah, I know. It really gets you. Just marinate on that for a moment and think about all of our policies and, our community-based systems. We need to be thinking about, what do we need to do to be prepared for an older population? Long-term care. we don't have long-term care, right? So we need to be working together in legislative sessions, thinking about what our policies are to really be meeting the needs and desires of older people and as people are aging. So that's really what we're striking out to do. Longevity Ready Maryland is a 10-year multi-sectoral plan, and we are working across agencies. I see some of my partners here from Maryland Department of Health, Department of Disabilities. I'm sure there's lots of other folks in this room that I'm not even seeing right now, that we are really looking at how we can convene, collaborate, and catalyze to really prepare our state for this older adult population. So, with that being said, what are we doing? We are enhancing coordination among private and public partners, federal and state and local governments and services to really co-design what our policies and programs need to look like in the next 10 years, okay? This is a long-term plan. We are looking at how we can adapt laws and regulations and policies that will promote capacity, building in housing, transportation, long-term care, and caregiver support. Affordable housing, we heard that, right? We are really looking at ways in which how can we as a department and as a state work together to keep people who are housed? And so many of you probably already know that the fastest growing population of people who are becoming unhoused are 50 and older. Okay, so we need to be looking at how do we partner together, and I'm actually really pleased to announce that we were awarded a very competitive technical assistance award through the Administration on Community Living for 4 departments to be working together to look at how we can address the homelessness situation here in Maryland. Those 4 departments are the Maryland Department of Aging, Maryland Department of Health, Department of Disabilities, and of course, Department of Community Housing and Department of Housing and Community Development, of course, right? And that's really important because this is something that you have not necessarily seen before, is the level of collaboration and coordination across agencies. We want to be braiding and leveraging resources, and that's both our human power and also our money power, okay? So yes, thank you. So what else are we doing? We're doing advocating for the governor's proposed FY25 budget, which has several key wins for our department. That includes more positions so we can do this work, so that we can be more actively engaged in policy planning and legislation. And we're taking a number of positions on legislation that is before the General Assembly now. And so you'll oftentimes see us testifying either in favor or opposing, and really, again, injecting that longevity lens into everything that we're doing, because we want to reframe the aging narrative so that we are able to really enhance and bring along our partners so that we can be longevity ready as a state. So thank you very much for the pleasure and privilege of being here, and I look forward to talking to you all later. Thank you.
Okay, thank you, Deputy Secretary Crawley. That's, we look forward to working with you on the Longevity Ready Maryland initiative. I have so there's 2 more deputy secretaries that I'm going to bring up to kind of speak about the things that are going on in their agencies, and I'm not sure which one to invite up first because they're kind of attached at the hip, you know, to some extent. One of the things that's often lost when thinking about policy development is really the matter of implementation. The legislative process is one huge part of it, but after bills are passed, someone needs to implement them, and our next 2 speakers are really leading the offices that are doing the hard work and are at the forefront to implement many of the new behavioral health initiatives that I was talking about, that we worked with Delegate Bagnall to pass in 2023. And so, again, you guys can pick whoever you want to come up first, but Deputy Secretary of Behavioral Health, Alyssa Lord, and Deputy Secretary for Healthcare Financing and Medicaid Director, Ryan Moran. Whoever wants to come up first. Thank you very much.
Thank you, Dan. And good afternoon. On behalf of the Maryland Department of Health, Behavioral Health Administration, it is an honor and privilege to be here with you today. I'd like to take a moment to thank the Mental Health Association for your ongoing partnership and collaboration in ensuring we are building a world-class, equitable behavioral health care system where we leave no Marylander behind. We must continue to make great strides in reducing stigma, increasing access, and building networks of quality and equitable care across the lifespan. We have created a framework for patient-centered whole-person care and substance use care, also known as the continuum of care. This model not only aligns with the Moore-Miller administration priorities and the significant programmatic, financial, and staff investments that are being made, but allows us to think about how individuals and families may need different services across a period of time. The continuum is not static, and each pillar of prevention, promotion, primary behavioral health, urgent acute care, and treatment and recovery do not live in discrete silos. Underpinning the continuum is the core tenet of equity, data-driven decisions, and transparency, and maintaining and expanding the workforce, not only within BHA, but within the community. Some of the elements of the continuum are already in place, and we've talked about this a little bit today, but we need to maintain them while being creative to build out new areas to ensure we are able to meet Marylanders where they are in a sustainable way. To do this, I'd like to take the next minute or two to talk about the investments we are making and will continue to make over the next 12 months. As some of you may be aware, as part of the governor and the lieutenant governor's commitment to behavioral health, an additional budgetary investment of $107.5 million was made to support the implementation and expansion of mobile crisis and crisis stabilization. Crisis and crisis stabilization plays a critical role in decreasing emergency department and inpatient utilization. It creates another pathway for providing care at the right time in the right setting. For context, currently all 24 jurisdictions offer mobile crisis coverage to varying degrees. However, only a few provide services, coverage, and/or staffing that meets the forthcoming regulations that were just published February 9th and are available for public comment. Regarding our crisis stabilization centers, 10 jurisdictions operate some form of walk-in crisis, but there are no crisis stabilization centers that meet the regulations in any part of the state. As evidenced by other states, including Arizona, Connecticut, and Missouri, we know the value of these services. We anticipate in the next week, we just signed off on them on Friday, announcing more than $13 million in grants to build capacity and enhance access to crisis care. Crisis and crisis stabilization is just one of the many components of the behavioral health continuum. Certified community behavioral health clinics, CCBHCs, we love acronyms in healthcare, will be another avenue for Maryland to improve service delivery to ensure coordinated, comprehensive behavioral health care. SB 362 HB 1249 from 2023, I'm sure y'all remember, requires MDH to apply for CCBHCs, the development and implementation grant funding from SAMHSA. And it is included as part of the state demonstration program for fiscal year 2026. We have continued to focus on implementing foundational levels of service and technology improvements that the state must have in place to develop CCBHCs successfully. Any grant dollars stemming from the potential award will allow MDH to develop processes to certify clinics as CCBHCs, establish prospective payment systems for Medicaid reimbursable services, and prepare the application to participate in a subsequent multi-year demonstration program. As we are building this network of integrated and synchronized system of care, we remain focused on SB 581, which calls for the establishment of the behavioral health care value-based purchasing pilot program. We have been convening, and while we recognize the importance of the establishment of the pilot, we are also seeking to establish a program that is sustainable and forward-thinking. More details are to come in the coming months as we draft our submission to CMS. We appreciate the excitement and the willingness to engage in the dialogue to bring value-based care to Maryland. Lastly, our behavioral health continuum of care endeavors to include culturally competent crisis services, address ongoing mental health and substance use needs, establish innovative and sustainable payment methodologies, and support all children, adolescents, families, and individuals in their communities. We are setting our sights upstream with a keen focus on prevention, promotion, and early intervention, addressing trauma, and to foster health and well-being for all. Collectively, we'll get there. Thank you.
Good afternoon. Now, there's two things you should know about me. Well, there's one. I was a preacher's kid. So there's two things I love: a call and response and a lectern. So, good afternoon. Yep, that's better. That's better. Linda, thank you for having us in the Department of Health to provide what is truly important updates of what's happening within Maryland Medicaid's program. As mentioned, I've met a number of you, but my name is Ryan Moran, and I serve as the Deputy Secretary for Healthcare Financing and the state's Medicaid Director. You already know the important role that Medicaid plays in meeting the state's behavioral health needs. And truthfully, and I don't say this lightly, but the Medicaid program nationally, across the country and here in Maryland, finds itself at one of the most historic moments since the program's creation. During the public health emergency, as you all know, individuals across the country maintained their eligibility for Medicaid coverage, and that meant in Maryland, we went from 1.4 million Marylanders or 1.5 million Marylanders on Medicaid to about 1.8 million at the start of what has been the national unwinding experience. And now, with the end of the public federal health emergency, Maryland is in the process of what is the unprecedented work of reviewing renewals of every single recipient on Maryland Medicaid. 9 months into this process, as we find ourselves in February 2024, we have processed more than 1.25 million renewals, and we are backed by a comprehensive campaign invested and supported in partnership collectively with our managed care organizations known as Medicaid Check-In, and this administration has been most aggressive with the federal waivers and flexibilities that are in place to ensure that the process is as easy and efficient as possible. And the one thing that I would ask from all of you is your continued vigilance in the last 3 months of this process to ensure that our goal, which is to ensure that every single Marylander that remains eligible for coverage remains covered. Today, I want to also talk about 3 other different policy priorities as it relates to behavioral health and how Medicaid is positioning its policy levers to create new access points and delivery models to support Marylanders. These access points are in lockstep with my colleague Alyssa Lord in the Behavioral Health Administration and the department under the leadership of Secretary Herrera-Scott. The overarching goals to make investments in different pillars of our behavioral health care delivery system. It will also ensure that this administration is leveraging federal investment dollars to support infrastructure, technology, workforce, and service delivery. A key investment as part of that we will make is in the continuum to serve our kids as part of early intervention behavioral health as part of school-based health care. In the wake of the Uvalde shooting, Congress passed in the national discourse related to gun control the Bipartisan Safer Communities Act, which included a number of Medicaid and CHIP provisions to ensure access to comprehensive health services and to strengthen school-based mental health care. And in May 2023, CMS released this comprehensive guidance. As part of our holistic approach to addressing children's behavioral health needs, the department immediately crafted an implementation plan that would allow its Medicaid program to reimburse our students outside of an IEP for mental health services for services delivered by school-based psychologists and social workers. And for the last year, the department has been partnering very closely on these plans with the Maryland Consortium of Community Supports under the leadership of Mark Luckner, which was established by the legislature as part of the blueprint to support the development of initiatives and partnerships to meet student behavioral health needs. The department's plan for behavioral health services to be reimbursed by Medicaid will begin. It's anticipated in 2025, And if we had to sum up this initiative for kids, it was that we are ensuring in Maryland that we're creating every choice for every child. This initiative provides additional access point for students who may be challenged by transportation or other barriers to receive care from trusted school-based providers, and is essential to MDH's vision, as you just heard, for comprehensive coordinated behavioral health care across our continuum. And also, for everyone else in the room, I want to be clear, it will require our schools to work in partnership with community-based organizations for more services that will be needed, and we look forward to partnership in that regard. Secondly, I want to address another landmark submission that Maryland Medicaid is in the process of submitting to CMS, and that is that we are seeking the support to support those experiencing incarceration to ensure successful reentry into their communities, with the ultimate aim of reducing recidivism and decreasing opioid-related deaths in our state. To advance the health outcomes, it's about time. Indeed. To advance the health outcome involved with the criminal justice system, Maryland Medicaid, we are seeking an 1115 waiver that will authorize Medicaid services up to 90 days pre-release for people with substance use and/or serious mental illness. And we are in the process. The public comment period closes today. I would invite you to read that on our website. The waiver will provide us the authority to cover pre-release services. That includes case management, 30-day prescription drug supply, and medication-assisted treatment. Participants, as designed, would be assigned a case manager, either in the incarceral setting or telehealth, and we've also worked to incorporate community health workers as part of our case management team in the 1115 submission. And lastly, I also want to thank Delegate Bagnall, as well as the Mental Health Association, for working with us since effective October the 1st, 2023. The Collaborative Care Program is now live for all Maryland Medicaid enrollees. The statewide expansion builds off a successful pilot program that included 14 primary care practice sites. And we are pleased to partner with the association and provider groups to continue to expand the number of practices, including pediatricians, in integrating that particular model. I'll close by saying that through these initiatives and other investments that are highlighted from the department today, we will be laser focused on the well-being of Marylanders to create a world-class healthcare system with equity at the center of our mission. Thank you for being here. Know also that Maryland Medicaid stands with you as a partner in this regard.